My name is Dr. Kunal Pingale, Junior Resident in the Department of Radiodiagnosis at DY Patil Hospital, Pimpri, Pune. Today I will be presenting a multi-center study on the impact of age and gender on HRCT patterns of interstitial lung diseases. Interstitial lung diseases are a diverse group of progressive lung disorder. HRCT is considered the gold standard for identifying ILD subtypes. However, ILDs don't look the same in every patient. They vary with factors like age and gender. Previous studies have hinted at this, but many lack multicenter validation. Our study addresses this gap by systematically analyzing how age and gender influence HRCT patterns. Our primary aim was to assess the influence of age and gender on HRCT patterns of ILDs. Secondary aims were to identify demographic correlations with specific radiological subtypes, provide evidence for integrating demographics into diagnosis, ultimately improve diagnostic accuracy, early recognition, and patient-specific management strategies. We conducted a multi-center cross-sectional observation study across 4 tertiary hospitals. We included 300 patients with suspected ILDs. Data collected included demographics, smoking status, occupational history, and comorbidity. HRCT was done using standardized protocols and 2 radiologists independently interpreted scans. Subtypes classified included UIP, NSIP, DIP, CTD, ILD, sarcoidosis, and LAM. Statistical analysis was done using chi-square and logistic regression test. We found clear age-based trend. Over 60 years, UIP was the predominant pattern, especially in males. 40 to 60 year NSIP and CTD-ILD were most common. Under 40 year, rare subtypes like sarcoidosis and LAM appeared. Age strongly correlates with ILD subtype distribution. UIP risk increased with advancing age, while autoimmune related ILDs were more common in middle age. This highlights the progressive nature of fibrotic ILD in older males. Gender differences were also significant. Males showed higher prevalence of UIP and DIP. Females showed more NSIP, CTD-ILD, and LAM. These differences were statistically significant. Autoimmune ILDs were more frequent in females, while smoking-related ILDs were more frequent in males. This suggests gender is an independent predictor of HRCT subtype and is useful for improving diagnostic accuracy. We'll now look at some representative cases from our study. Case 1 is a 53-year-old male with honeycombing in subpleural regions, classic UIP. Case 2 is an 83-year-old male with emphysematous changes and diffuse ground glass opacities, again consistent with UIP. Case 3 is a 53-year-old female showing septal thickening, ground glass, and traction bronchiectasis without honeycombing, typical NSIP. Case 4 is a 20-year-old female with multiple lung cysts and distortion, LAM. Case 5 is a 78-year-old male with peripheral ground glass opacities and emphysema, DIP. Key takeaways from the study: age over 60 strongly predicts UIP, female gender predicts NSIP and CTD-ILD, integrated demographics improve HRCT interpretation accuracy. Our findings align with global literature and emphasize the value of patient-specific approach. Clinically, this supports tailored diagnostic and treatment strategies fitting into the broader framework of personalized medicine. Our study has some limitations. Being cross-sectional, it doesn't track disease progression. Rare ILD subtypes were underrepresented due to small sample size. We did not include genetic or biomarker data. Despite double readings, some inter-observer variability may exist. Since we focus on tertiary care centers, result may not generalize to broader population. To conclude, age and gender significantly shape HRCT patterns of ILDs. UIP dominates in elderly males. NSIP and CTD ILD are more common in middle-aged females. These demographic predictors enhance diagnostic accuracy and support individualized management. Our multi-center study strengthens the external validity of these findings. We recommend integrating demographic profiling into ILD diagnostic framework for better outcome.